Hello everyone and welcome to our YouTube channel. I, Shalki Tripathi, will be presenting on the topic Clinical Method of Studying Human Development under the guidance of Professor Dr. Rajeev I.Jha. Today I'll be covering three case studies, merits, limitations and conclusion. My first case study I'll be talking about Raja. Have you ever met someone who seems to be two complete different people? Today we'll be diving into the baffling case of Raja. At school, Raja's an angel, polite, helpful, teacher's pet. But at home, he is a demon, violent, destructive, and a constant source of stress. His family is desperate for the answers for his behavior. So, the process of clinical method is of two types, diagnosis and treatment approaches. In diagnosis, we'll be talking about the previous experiences, the events happened in his life, reactions, why has he shown those reactions, what has affected him, the current surroundings. Treatment approaches would be the change in the environmental forces and the mindset of the individual. So, drafting a case study, we have to identify these four things. Identification, data identification, wherein we have to identify a child's name, age, place, the birth history, the family history, the medical histories, medical reports, academical records. Environmental background, information about his child peer groups, socio-economical status, neighborhood, and the interaction of the child with the surroundings. Development history focuses more on the child's development uh, based on the medical reports, the parent's observation. Identifying the behavioral issues, what all issues he had, what all past experience he has seen, diagnosing that. Understanding the background. It could include medical history, ruling out all the underlying conditions, family dynamics, exploring potential stressors and strained relationships. Could also include social environment, examining peer groups and neighborhood influence. The development history, understanding Raja's growth and entangling the web. We could talk about the development history. What all things are required in a child? The terms physical, emotional, and cognitive development plays a key role. They work all together. The significant events or experiences happened in the child's life could also result in the behavioral change. Sometimes a change in scenery can work wonders. This could involve resettlement, moving houses, changing schools, or adjusting living arrangements. Shifting expectations, the parents, teachers, and the peer adjusting their perspective on Raja, transforming the mind, individual mindset shifts. It could also include therapies, but true change comes from within. Raja needs to develop a healthy coping mechanism. This could include counseling, guidance, providing a safe space for Raja to express himself and to learn new skills. Therapies, CBT, game therapy, REBT, and other approaches can also help Raja to reframe negative thoughts and develop adaptive behaviors. Raja's journey wouldn't be easy, but with the right approach, he can bridge the gap between his two worlds and find peace within. As we all know, Raja had a drastic behavior, but after all these approaches, this indicated what all things we need to address in child's behavior. If if a child is showing this kind of behavior, we need to consult psychologists as they help in diagnosing and treating such behaviors. This is the mind map of case study 1. In my second case, I'll be talking about Sarah, a 2-year-old girl. Ever wonder how little brains unlock the magic of language? Today we'll meet Sarah, a bright 2-year-old on a special mission, supercharging her words. Sarah, a whiz at playing but talking felt tricky. Compared to her friends, words didn't quite flow. That's why she embarked on 12-week adventure, a 12-week intervention program. Wherein interactive games, think Peeky Poo on steroids, fun activities to spark conversation and build vocabulary. Speech therapy sessions, one-on-one time with the language guide to master those tricky sounds and sentence structures. Talk time with mom and dad, home become a language lab. Tips and tricks to fill every day with rich, engaging conversations. Before and after Sarah's adventure, we peeked inside her world. Skill check, standardized test, gauged her language progress, checking if those words were taking flight. Observing Sarah's in action from background chats to dinner time talks, we saw how Sarah interacted with her family and friends. Brain scan Peekaboo, a fancy machine called fMRI, showed us how Sarah's brain lit up when talking, revealing the magic happening inside. So we observed that Sarah's interaction with her family and peers wasn't controlled. Her language and social interactions were not that too much. Neuroimaging methods was also used, giving the insights into the neurological elements of Sarah's language acquisitions. As a result, improved in language skills, her vocabulary, grammar was improved. She started engaging into conversations and having a good social balance. She was also engaged in social interactions. She started talking more, participating in group activities. Neuroimaging findings on language development. The fMRI alterations in Sarah's brain activation patterns indicated the effects of the interventions on her language processing. Sarah's story is a reminder that early interventions can play a game changer for kids with language delays. With the right support, little ones can unlock their words and embrace the beautiful symphony of communication. This is the mind map of case study 2. In our third case study, we met Emma, a 15-year-old battling anxiety, a monster, and exploring how a special therapy called CBT helped her reclaim her life. CBT isn't magic, but it's pretty close. This therapy equips you with tools to understand and manage your anxiety. Imagine it's like learning a new language, the language of calmness. Self-reported anxiety evaluations, participants were given a standardized questionnaire wherein they know the anxiety level. Beha- Behavioral insights, the standardized questionnaire is examined and the interviews are taken with the teenagers and their parents to analyze the behavioral changes. Qualitative interviews, wherein the interviews were conducted to understand Emma's experiences, the feelings she has, and the cognitive behavioral intervention. But certain behavioral changes were seen. She started to get improved academical performances. In a 10-week program, the self-reported anxieties were decreased. The qualitative observation, Emma's interactions, the mechanism, behavioral changes, as well as the parents' perspectives, experiences was successful. This is the mind map of case study 3. There are certain merits, a connection between the interventions and the childhood development of the outcomes. It is more on ensuring the welfare and the potential risk, overweight for the informed decision making. Evidence-based interventions, it is more on the causal inference and identifying the efficacy techniques. It also includes medical professionals' decision. Standardized protocols, it ensures the intervention's delivery, replication of the studies to validate results, provides a very solid foundation, and also guides the application of the techniques of the efficacy. Few more merits. Informed decision making. The clinical trial results aids parents, caregivers, and the medical professionals are informed the decisions about the interventions for a healthy childhood development. Ethical consideration. Ethical standards are used. They are ensured for the young subjects. They approve before regulating. Approval are taken for the trial commencement. For any merits, there are certain limitations. Potential risk and benefits of the interventions for child participants ensuring the welfare and the study benefits. Clinical trials controlled conditions also limits can result in the fail to capturing the real world settings. Longitudinal trials are complex and resource intensive. The challenges are seen in capturing the changes in the child's circumstances over the time. Few more limitations. Parental involvement plays crucial role in the success of childhood development. Because of the communication and flexible scheduling strategies, it helps in improving the parental involvement. Understanding individual differences, focusing on the group level outcomes, it may not fully capture the diverse range of cognitive, emotional, and social aspects of the childhood development. Requires substantial financial and human resources, potentially limiting the research quantity and limiting progress. In conclusion, CBT for teenagers' anxiety shown a positive outcome, demonstrating the effectiveness of the interventions in reducing the anxiety symptoms. Moving forward, it is important to balance the use of clinical trials with other research methods. Despite limitations, merits are evident in establishment of evidence-based interventions and informed decision-making. These are the merits and limitations of childhood development. These are the references which I have referred for the source of my presentation. I hope you enjoyed this video. Thank you.